Question number 1. A 67-year-old male client has been complaining of sleeping more, increased urination, anorexia, weakness, irritability, depression and bone pain that interferes with his going outdoors. Based on these assessment findings, Nurse Richard would suspect which of the following disorders? If we see the options, option A, diabetes mellitus, option B, diabetes insipidus, option C, that is hyperparathyroidism, and D, hyperparathyroidism. Here the correct answer is option D, hyperparathyroidism. Hyperparathyroidism, that is the most common in old age people, and it is characterized by bone pain and weakness from excess parathyroid hormone production. So the clients also exhibit hypercalciuria, causing polyuria for the patient. And let me see the other options. While clients with diabetes mellitus and diabetes insipidus also have polyuria, and they don't have bone pain and increased sleeping. The option C, that is hyperparathyroidism. So that is characterized by urinary frequency rather than polyuria. Question number 2. A client with allergic rhinitis asked the nurse what he should do to decrease his symptoms. Which of the following instructions would be appropriate for the nurse to give the client? Option A. Use your nasal decongestant spray regularly to help clear your nasal passages. B. Ask the doctor for antibiotics. Antibiotics will help to decrease the secretions. C. It is important to increase your activity. A daily brisk walk will help promote drainage. The option D, that is keep a diary if any symptoms occur. This can help you to identify what precipitates your attacks. So here the correct answer is option D, keep a diary if any symptoms occur. This can help you to identify what precipitates your attacks. So it is important for the client with allergic rhinitis to determine the precipitating factor, so they can able to avoid it. Keeping a diary can help to identify these triggers factors. So the nasal congestion sprays that should not be used regularly because they can cause a rebound effect for the patient. So antibiotics are also not appropriate. So the increased the activity will not control the client's symptoms. In fact, walking outdoors that may increase them if the client is allergic to pollen. Question number 3. A patient with severe cirrhosis of the liver developed hepatorenal syndrome. Which of the following nursing assessment data would support this? If you see the options, option A, oliguria and azotemia, option B, metabolic alkalosis, C, decreased urinary concentration, D, weight gain of less than 1 pound per week. Here the correct answer is option A, oliguria and azotemia. So patient with hepatorenal syndrome, so it is a functional disorder that is resulting from redistribution of renal blood flow. Oliguria and azotemia, that is occur abruptly as a result of this complication. So let me see other options. The first option B. So here patient is having metabolic alkalosis. The option B it is taken. If patient is having hepatorenal syndrome, excess organic acids are not being excreted by the damaged kidneys. So that is resulting in an elevated concentration of hydrogen ions and decrease the pH level. That causes metabolic acidosis, not metabolic alkalosis. So the other option, that is option C, here it is telling that is decreased urinary concentration. So if the patient is having hepatorenal syndrome, the concentration of the urine is increased with decreased renal function. And the option D, that is weight gain of less than 1 pound per week. Okay. So with renal insufficiency, significant weight gain is expected due to fluid retention. Okay. So here more appropriate is option A, olguria and azotemia. Question number 4. A client with subarachnoid hemorrhage is prescribed a 1000 mg loading dose of dilantin IV. Which consideration is most important when administering this dose? Let me see the options. Option A, therapeutic drug levels should be maintained between 20 to 30 mg per ml. B, rapid dilantin administration can cause cardiac arrhythmias. C, dilantin should be mixed in dextrose in water before administration. And D, dilantin should be administered through an IV catheter in the client's hand. So here the correct answer is option B. Rapid dilantin administration can cause cardiac arrhythmias. Okay. So dilantin, that is a trade name of phenytoin. So phenytoin, that is mainly given to the patient to prevent seizures. Okay. Especially the patient who has subarachnoid hemorrhage is chance to get seizures. To prevent that, we are giving phenytoin. It acts as an antiepileptic. So the injection dilantin should not be given at the rate exceeding 50 mg per minute. So rapid administration can depress the myocardium and causing arrhythmias. And if we see the other options, the option A, that is therapeutic drug level, that is range from 10 to 20 mg per ml, okay, not 20 to 30 mg per ml. The other options, the option C, the dilantin should not be mixed in solution, okay, like water, okay, for administration. Okay. So it compatible with normal saline solution. Okay. So we can able to inject it through an IV line containing normal saline. Okay. The option D, when we given through an IV catheter in hand, dilantin can cause purple gloss syndrome to the patient. Okay. So we can't able to administer through IV, okay, in patient hand, in client's hand. So purple glow syndrome means that is the patient, that is a complication of phenytoin. Okay. So patient who having a purple glow syndrome, they have pain, edema and discoloration at the site of injection, and it can spread to the distal limb. Question number 5. A nurse is assessing electrocardiogram rhythm strip. The P waves and QRS complexes are regular. The PR interval is 0.16 second and QRS complexes measure 0.06 second. The overall heart rate is 64 beats per minute. The nurse assesses the cardiac rhythm as options A, option A, normal sinus rhythm, B, sinus bradycardia, C, sick sinus syndrome, and D, first degree heart block. Here the correct answer is the option A, normal sinus rhythm. Okay. So here the patient's PR interval and QRS complexes, it's showing that it is normal. Okay. So the PR interval measuring 0.12 to 0.20 seconds is considered as normal, and the QRS complexes 0.4 to 0.10 second is considered as normal. Okay. So here the patient having PR interval and QRS complex is normal. Okay. Let me see other options. The option B, sinus bradycardia. Okay. So in sinus bradycardia, there is a normal upright P wave in lead 2, okay, and it is also called as sinus P wave. So it's preceding every QRS complexes with the ventricular rate of less than 60 beats per minute. Okay, so in this question it is showing that patient is having 60 beats per minute. Okay. In sinus bradycardia, patient is having less than 60 beats per minute. Ventricular rate is present. Okay. So that answer is wrong, and the option C, this patient is having sick sinus syndrome. Okay, so in sick sinus syndrome, that is including sinus bradycardia, okay, and sinus pauses and sinus arrest. These three conditions is involving in sick sinus syndrome. Okay, so in sinus bradycardia, the heart rate, that is patient is having less than 40 beats per minute is present, and in sinus pauses, the patient is having sudden pauses of sinus node, okay, that is shorter than 2 to 3 seconds is present, and in sinus arrest, the patient is having sudden pauses of the sinus node, that is longer than 2 to 3 seconds is present. First degree block. Okay, in first degree block, the PR interval of showing that it is greater than 0.20 seconds. Okay, so the normal rate is 0.12 to 0.20 second. Okay, so in first degree block it is greater than 0.20. Okay, that is without disruption of the atrial to ventricular conduction. So this option D also incorrect. So the correct answer is option A, normal sinus rhythm.